what is your responsibility if somebody will ask for home care?
Well, in my experience as a carer that I've been doing for 7 years, our responsibility is to go into a person's house who needs looking after and assess the environment that they're living in, i.e. there could be risks and dangers in there hidden that not many people would understand. Like when I go in, I observe and I see that rug could be on the floor a little bit dangerous. She could slip. I might look at the whole stair situation and say, I believe that your mother or father needs to be moved back downstairs and have everything downstairs. Obviously, we'd have to talk to the occupational therapist or to the physiotherapist and see what their professional needs are, medically.
So teamwork, yeah?
Teamwork. I think it's just a matter of the doctors being involved, the physiotherapist being involved. We have to know what medication they're on because it's my responsibility to maybe administer that medicine, which means we have to make sure everything is clear, documented, written down, and of course PPE, which means gloves, maybe an apron needed to wear. And hygiene is obviously paramount. It's the first thing.
So all family, they are cooperated with you?
Yes, we usually speak to the family and we say, this is what we believe your loved one needs. And diet as well. We have to think of nutrition. Are they eating properly? Have they got the right diet in place? We could do all of that for you.
So nutrition, tell us how the steps is, what you can do, what you can help.
Well, we can, obviously look at their diet that they're having today and maybe improve it and eliminate a few things maybe that are distracting them. Say with dementia, sometimes, they don't want to eat or they feel that they forget to eat. So it's my job to prompt and remind them and help them eat or encourage them or drink. Obviously, intake of fluids is very, very important, especially in a Mediterranean country. We recommend about 1,000 mils of liquid a day, probably more, possibly more, or sometimes an extra supplement like a nutritional drink that can help build them up if they've lost their appetite, on some foods.
Well, that we will talk in later.
Yes.
But what you can help more, tell us all the details.
Well,
with
when
mobility.
With mobility, obviously there's certain aids. You can either, if the person can walk, you can encourage them to get out and have a little walk around their garden.
Perfect, yeah.
Or you can get these obviously standing aids that will help them walk along and stabilize them.
All right.
And also there's other things of transporting a person from a bed. You can use it's called a Sarah Steady, which is a lovely machine that if they just want to hold on to the handles and pull themselves up, they can do that.
So what is the message, benefits of the home care?
The message I would give is one, to use a very good, reliable company that has a whole team of network behind them. Meaning what? Meaning we have doctors, we have trained nurses, we have equipment that we can supply, we have trained carers that are there to know what their service users' needs are, and also we have physiotherapists that can come in, we have an ambulance service so that if there was an emergency we could take them immediately to the doctors. These are all the benefits, and also we have records that are written down so that there's always a history of what's going on with your loved ones.
So the same like in the clinic or in the hospital?
Yes, so basically it will be exactly the same as a clinic or a hospital. It's just that you're providing that home service within your home, but you are not depriving them of anything because they will have that team around them.
So they can manage the wound dressing? Or
yes, there'll be wound
catheter,
dressing, catheter care.
Okay.
There would be bed sores checking out to make sure that they're not producing any bed sores. There will be other nurses in and out, physiotherapists. As I said, the whole setup will be like a mini hospital in your home, basically.
Okay.
That's what I would like to put over as a good company.
Okay.